Hi everyone, my name is Dr. Natasha Wood. I'm one of the Menlo Park vloggers. If you want to stay up to date with any new videos that we're bringing out, then please do follow along Menlo Park on their social media platforms. Now, I'm a GPST3 trainee in the Southwest, and today I'm going to be talking to you about working in medicine whilst managing, looking after ourselves. People say that doctors make the worst patients, and I suppose I want to talk to you a little bit today about my own experiences of juggling work with looking after or taking care of kind of chronic health conditions. Now, I was diagnosed with inflammatory bowel disease when I was an F1 working on the gastro ward. It kind of dawned on me that I should probably get myself checked out when I realised that all of my symptoms were pretty much the same as my patients. But I did put it off for a good long while, or for as long as possible, before finally booking an appointment with my GP. And I think in medicine there is still quite almost like a pressure and expectation that we are superhuman and therefore we don't get ill and we don't need to go to a doctor for help. But actually, taking the time to look after yourself is really important, because the line of work that we are in is absolutely amazing but can be exhausting. And if you're not feeling 100%, it's really hard to give that 100% to your patients. Now, over the years, since kind of F1 and into specialty training, I've been juggling trying to manage this condition, which sometimes is absolutely fine and I feel fit as a fiddle, and other times I'm kind of having to rush to the toilet in between patients and on some medications which make me feel pretty rough. And I think not just being honest with yourself about when you're not feeling 100%, but also being open with colleagues. Doesn't need to be in any sort of particular detail, but just letting them know that actually you need some time, whether that's for a physical health condition or your mental health. We do need to show the kindness that we show to our patients, to ourselves, to prevent us burning out and just being able to keep doing the jobs that we love. I know from speaking to colleagues that often it almost seems easier to explain to colleagues that you're not feeling 100% from a physical health perspective, and we're almost constantly looking for validation that yes, we're unwell, or our temperature was 38.9, or something concrete. But as we would often say to our patients, physical health and mental health are intertwined. I find that my condition seems to flare up at times of stress, and I think there's so much about that interplay between physical and mental health that we still don't understand, that needing time off for your mental health is nothing to be ashamed about, and your colleagues should support you, and treat you just the same as if it was because you had COVID or because you had the flu. And I think the more that we talk about these things, the less stigmatized it becomes, and it just becomes another kind of normal part of working life and far more accepted. So hopefully going forward, you guys feel, regardless of what point of training you're at, whether you're in med school, foundation, or fully qualified, I hope that next time you're feeling unwell, you feel a little bit more comfortable to say, actually, maybe I do need some time to rest up, get better, and take it take it from there. Let me know your thoughts if you've had any kind of similar experiences or difficulties, and yeah, I'll try and answer any questions in the next video. Cheers.